You may have childhood memories of being pushed around and being punched by others when you felt you couldn't fight back. You may also remember being the topic of nasty rumours or being excluded by others. Sadly, being bullied is still common today. Bullying involves hurting someone many times where the person being bullied finds it hard to defend themselves. Researchers have studied pairs of identical twins where one twin had been bullied whilst the other had not. The twin who had been bullied showed more symptoms of anxiety and depression compared to their co-twin who had not experienced bullying. Due to the twins being genetically identical and growing up in the same home environment, these factors cannot explain the difference in the twins' mental health outcomes. Therefore, we have strong evidence that bullying has a negative impact on young people's mental health from an early age. This suggests that initiatives aimed at stopping bullying behaviours in schools should be supported and encouraged. If we reduce bullying behaviours, we decrease suffering and mental health problems among young people. But research also shows that mental health problems among young victims of bullying do not cease once bullying has stopped. Using data from studies that span across several years, researchers have found that those who were bullied in childhood had increased levels of psychological distress, depression, anxiety, and suicidal thoughts in the adult years, and these associations remained even after considering other factors that could contribute to poor mental health, including emotional and behavioural problems in childhood, low IQ, parental socioeconomic status, and other forms of adversity in childhood. Together, these studies indicate that we must not only aim to stop bullying behaviours at school, but we should extend our efforts to provide young victims with adequate support to limit the harm associated with being bullied at a young age. We can strengthen interventions aimed at tackling mental health problems related to bullying victimisation by focusing on young victims. We can do this in two ways. First, we can build resilience among young people who have been bullied. Programs that provide the tools and the skills to overcome this negative experience could benefit all young people. These programs could also provide more targeted support for some young people who need it the most. Secondly, we can work harder to prevent young people from becoming the victim of bullying in the first place. Bullying is not just being at the wrong place at the wrong time. Children who show early signs of mental health problems, children from deprived areas, and children who are already victims of abuse at home are at risk of experiencing bullying. In a new policy briefing document, it's recommended that interventions aiming to prevent the mental health consequences of bullying should 1. Be part of a wider mental health and education agenda rather than independent initiatives. 2. Use existing resources or approaches whenever possible, both anti-bullying policies and mental health initiatives. 3. Use widespread interventions while giving extra help to those at higher risk. 4. Tailor interventions considering age groups and focus on key transitions. 5. Evaluate outcomes and ensure sustainability. We must recognise that being bullied early in life contributes to the development of mental health problems, and those problems may last for a long time. To take a stand against bullying, we must make it a priority for the public. We must recognise the long-term mental health problems that can emerge as a result. Because when society values something, it will invest in it.